Crossing the age of 45, each of us steps into a major turning point in the journey of life. It is when hair begins to grey, wrinkles start to appear at the corners of the eyes. But it is also the time when the heart literally has tirelessly beaten billions of times to keep life going. However, at this very milestone, the heart becomes more fragile than ever before against the silent dangers of cardiovascular diseases, a hidden killer that rarely makes a sound until it is too late. Therefore, listening to the early signals that the body sends, no matter how small, is the golden key to protecting the health of oneself and loved ones. Why does the risk of heart disease surge after the age of 45? The answer lies in a combination of many factors. First, natural aging causes the arterial walls to gradually lose their inherent elasticity, becoming thicker and stiffer. As a result, blood has to flow through increasingly narrow and rigid pipes, forcing the heart to work harder, leading to higher blood pressure and a more pronounced risk of atherosclerosis. Not only that, hormonal changes also play an important role, especially in women entering the perimenopausal and menopausal stages. Estrogen, a hormone once considered a shield, protecting blood vessels, gradually decreases, causing the risk of heart disease in women to quickly catch up with men. Alongside this is the accumulation of unhealthy lifestyle habits over many years. Smoking, eating a lot of fatty foods, lack of exercise, prolonged stress, which sometimes only catch up with the body at this age. And don't forget, underlying conditions such as diabetes, high blood pressure, and lipid disorders also often appear or worsen at this age, further increasing the burden on the heart. So what are the early warning signs that you must not ignore? The first and most typical sign is chest pain, also known as angina. But don't be quick to think that a heart attack always causes severe pain, like in the movies. In reality, many people only feel as if a heavy object is pressing on their chest, a sensation of tightness, squeezing, or fullness in the middle of the chest, sometimes spreading to the shoulders, neck, jaw, back, or upper abdomen. This pain can occur when you exert yourself, climb stairs, carry heavy objects, or even while resting. Especially if the pain lasts for several minutes, may disappear and then return, you should not be careless, as this could be a signal of an impending heart attack. In addition, shortness of breath is an equally important sign, but it is often overlooked or mistaken for respiratory diseases. You may feel breathless when walking, doing housework, or even when resting. If you need to prop yourself up with extra pillows to sleep because of a feeling of suffocation when lying flat, be careful. This is a sign of heart failure when fluid begins to accumulate in the lungs. Especially sudden shortness of breath without a clear cause is an emergency signal that requires immediate attention. However, not everyone experiences those classic symptoms. In many people, especially women, the elderly, or patients with diabetes, heart disease manifests through silent signs that are easily overlooked. The first is an unusual feeling of fatigue, exhaustion, despite not doing heavy work. It is not just the tiredness after a day's work, but a feeling of energy depletion, having no strength left to do everyday tasks like bathing, shopping, or cleaning. Nausea, indigestion, and pain in the upper abdomen, symptoms that seem to be related only to the stomach, can also be signs of a heart attack, especially in women. If these symptoms appear suddenly, are not related to meals, and are accompanied by other signs, such as cold sweats or dizziness, consider a cardiovascular issue. Dizziness, vertigo, and the feeling of about to faint are also signals indicating that the brain is not receiving enough blood due to the heart pumping ineffectively. Sometimes you may feel your heart beating irregularly, skipping a beat and then pounding again, or experience unexplained palpitations. These are arrhythmias, a potential risk for serious events. Sudden cold sweating, even without physical activity or hot weather, is also an early warning sign of an acute heart attack. The body responds to the lack of blood by activating the sympathetic nervous system, causing sweating, pale skin, and chills. Some people also notice swelling in the feet, ankles, and abdomen, shoes suddenly feeling tighter, or when pressing on the skin, the indentation takes a long time to disappear. This is a consequence of heart failure, when the blood is not pumped back to the heart strongly enough, causing circulatory congestion and fluid accumulation in the tissues. So if you or your loved ones show these signs, what should you do? The first and most important thing: absolutely do not be subjective. Do not try to endure or wait for the symptoms to pass on their own. With heart disease, every minute counts, and timely action can save your life. If dangerous signs appear such as chest pain, difficulty breathing, cold sweat, or severe dizziness, call emergency services at 115 immediately. Do not drive yourself to the hospital. Medical staff will provide initial first aid and take you to a facility equipped with specialized cardiovascular equipment. If the symptoms are mild, record the details: what you feel when they appear, how long they last, and whether there are any factors that increase or decrease the symptoms. Then see a cardiologist as soon as possible. Don't hesitate to share even the seemingly trivial things, as those small clues help the doctor make a more accurate diagnosis. In addition, even without symptoms, people over 45 years old should have regular health checkups at least once a year. Measuring blood pressure, testing blood lipids, blood sugar, heart ultrasound, and electrocardiogram. These seemingly small actions can detect many hidden issues early, helping you proactively prevent serious complications. Not only stopping at early detection, protecting the heart also requires each person to positively change their lifestyle. Start with simple things. Eat healthily, limit animal fats, increase vegetables and fruits, control weight, say no to tobacco and alcohol, spend time exercising regularly every day. Don't let work pressure and life drag you into a spiral of stress. Learn to relax, take care of your mental health, and keep your soul peaceful. Your heart has accompanied you and endured countless hardships for many decades. Don't wait until it speaks out through sharp pains, severe shortness of breath, or serious incidents to realize the value of health. Every abnormal sign, no matter how small, is a message, a warning bell that you need to pay attention and take action. Listen, understand, and cherish every precious beat of your heart. Finally, remember that protecting your heart is not only a responsibility to yourself, but also a priceless gift for your loved ones. A healthy heart is the foundation for all joy, achievements, and happiness in life. Start today by listening to your body, recognizing early warning signs, proactively checking your health, and maintaining a scientific lifestyle. That is the way for you to continue fully enjoying every precious moment with your family, friends, and loved ones. Your golden heart deserves the best care, attention, and protection. Take action before it's too late.